Hello, I'm Leslie Acoca, and I'm a Stoneleigh Fellow. About 12 years ago, I was sitting in a Northern California courtroom acting as an expert witness, and I watched a young woman who was only 5 feet tall and 8.5 months pregnant walk through the courtroom fully shackled, her belly, her ankles, and her wrists, hobbling down the center of the courtroom and sitting down at the defense table. And I could see when she sat down that the chains dug into her belly. And at that point, although I had nothing to do with that case, I stood up in the courtroom and said, "What is going on? Why is this, what looked to be a child who was pregnant shackled?" And I was told by the judge that she was a flight risk. I then asked the judge if indeed he had ever been pregnant and was escorted out of the courtroom. I was so incensed by that experience that I went to work with the head of the California Department of Corrections to create the first legislation in the country that made home-based or community-based home-like settings for pregnant prisoners and their children. Shortly after that, as I was running one of the largest youth violence prevention programs in the country in San Diego, my younger brother was brutally murdered 50 miles away in Los Angeles by a 22-year-old young man who had never had any help. So rather than feeling punitive or vindictive, I wanted to put that personal experience to work. 750,000 children enter the juvenile justice system every year, and the fastest growing segment of those are very young girls. And girls have special needs. They're more likely to be victimized, and yet the services within the juvenile justice system are primarily designed for boys, and that's true of the medical screens too. Only 18% of all the facilities across the country, and there are 3,500 of them, ask questions specifically about pregnancy for girls. So over the past 5 years, the Children's Hospital of Philadelphia, Juvenile Law Center, and I have created the first medical screen specifically for girls 11 to 17 in the country. And the purpose of that is that their health and mental health and behavioral health problems are identified immediately and prioritized. If a girl has been raped or sexually assaulted, it's identified immediately. If she has tuberculosis, if they're miscarrying, it's identified immediately. The other important piece of the Girls' Health Screen is that we hope that it will become part of an electronic health passport that not only serves girls in the juvenile justice system, but in their community. By creating access to the most underserved young women in the country, we're trying to create healthcare without bars. And we know that creating access to healthcare both inside detention and in the community for this growing number of young women and their children will not only promote their health care, but that of their children and that of their community, and it will decrease crime everywhere. The health system and the justice system don't often talk. People don't realize that kids are entering the juvenile justice system with increasingly serious health and mental health problems. So Stoneleigh's support for me and the other participants in this project has literally been life-sustaining. And when the Girls' Health Screen enters juvenile justice facilities as the new way to deliver health care for girls nationally, it could not have happened without the Stoneleigh Fellowship. It's really that simple. Without Stoneleigh, it would have stayed on a shelf somewhere instead of improving the lives of girls.